This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about why does my hip hurt when I sleep on my side. If you like this video, we put out new content weekly, so please like and subscribe. So why does your hip hurt when you lie on your side? Mostly all the time it's because you have something called hip bursitis. So most of the time when people get hip joint pain, it's pain in their groin. Sometimes it can kind of refer to the back area of the butt or to the side, but most of the time, like hip arthritis, hip labral tears, is growing pains. And most of the time pain on the outside of the hip is something called hip bursitis. So basically you have your hip, which is here, and then on the side of the hip you can feel it, where you can kind of push on the side, and then your IT band sits right on top of that. So if your hip abductors get weak, or you go on a long hike or something like that, or your abductors get tired, the IT band will start rubbing on that greater trochanter, and it'll cause inflammation. And now there's something there called a bursa, which is supposed to prevent friction. We have them all over our bodies, but that can get inflamed and painful. So a lot of times it's just you poke someone right in the side of the hip and they have something called, and it's greater trochanteric bursitis. X-rays are usually normal, MRI is usually normal. But if it's really bad, they usually can't sleep on that side because you're just smushing the IT band into the greater trochanter and it causes pain. There's other sort of things in the hip. You can have abductor tears or something like that. That'll hurt when you move your leg out to the side, but most of the time you get treated for greater trochanteric bursitis and it'll go away. And then if it doesn't go away, then you tend to look for the abductor tear to see if something's missing, and that will show up on an MRI. But for the most part, the treatment for greater trochanteric bursitis is doing core and abductor strengthening. That'll create space between the IP band and the greater troch, and that should prevent the rubbing and prevent pain, strengthening those areas. What happens is when the abductors get weak and your hip gets tired, it stops rubbing and causing pain. So if you can strengthen them, you'll prevent them from rubbing. Also, steroid injection can work wonders in this area. It generally can almost essentially be curative. But that's generally what it is. When hips hurt, when you're lying on your side, it's almost always greater trochanteric bursitis. I hope I was able to answer your questions pertaining to that topic. If you have any questions that I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only.